Hi, this is Dr. Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. Please remember these videos are not intended to replace visits with your physician. If you have questions, we're happy to see you here in our office, area code 775-359-7111. We can get you in even as a new patient same day. So feel free to give us a call here and schedule an appointment. Today what we want to talk about is human papillomavirus and human papillomavirus vaccine. You're going to see a lot of advertisements for this on television, on the news, and just a ton of discussions about this in parenting magazines and, for that matter, in teen magazines, and it's just all over the place right now. And there's a lot of questions that come up. So the first question is, what is human papillomavirus? Human papillomavirus is a virus that produces, most commonly, warts. There are hundreds of strains of human papillomavirus. It only affects humans, hence the H in HPV, the human in human papillomavirus. So no, you don't get this from frogs or toads or chickens or anybody else. You get it from other humans. Different strains cause warts or growth in different places. The strains that cause warts on your feet and warts on your hand are not in any way related to the kinds of stuff that we're talking about with HPV vaccines, so we can kind of forget about those. They have about as much in common with the human papillomavirus strains that we're talking about as I do with Al Capone. We're both Italian. Al Capone died 30 years before I was born. My family's from a different part of Italy and never met the man. And I don't know a single mobster. But yet we're both Italian, so there you have it. The strains we're interested in are cancer-causing strains. And there are certain strains of human papillomavirus. Again, they have nothing to do with the strains that cause warts on the hands or feet. So if you have warts on your hands and feet, don't worry, you're not going to get cancer from them. But they're potentially nasty. The cancer-causing strains, that is. And they cause cancer in any of a number of really unpleasant places. So roughly 90% of cervical cancers in women are caused by human papillomavirus. Cervical cancer worldwide is the #1 cause of female cancerous deaths. And it is preventable with the human papillomavirus vaccine roughly 95 to 97% of the time. However, you need to be vaccinated before you're exposed to those cancer-causing strains. Once a woman has picked those strains up, the virus or the vaccine won't do you any good to prevent them. So it won't help you clear pre-existing conditions. Some of those strains, or many of those strains, are also known to cause anal cancer and anal warts. And a perfect example of that is, I have some students here in the background. Help me out. Which model just died recently?
I know who this is.
It was Charlie's Angel.
Farrah Fawcett.
Farrah Fawcett, yeah.
Unfortunately, Farrah Fawcett was born a little late. Had she been born earlier, or been born later, been born today, she would not have had to die, and she would not have had to have her disease. Completely preventable in 95 to 99% of cases, and good chance that Farrah's disease would have been preventable with one of these two vaccines that are available. These strains, these same strains of cancer, can cause warts on the penis for men and warts on the external genitalia for women. The warts per se, other than being unsightly, are not particularly problematic, but the virus, again, can be spread, and these diseases can be prevented. Very, very rarely, but definitely significantly, the cancer-causing strains of these viruses can cause cancer on the tip of the penis as well for men, especially in uncircumcised men. Human papillomavirus affects 1 out of 9 young females. And most of the strains are covered by the vaccine. So these infections are rampant, they're ubiquitous. This is the most common sexually transmitted disease, and we can do something to prevent it. Furthermore, there is some evidence that up to 50% of oropharyngeal cancers, those are cancers of the mouth, the tongue, and the head and neck are somehow associated with human papillomavirus, and we don't completely understand that. We know that there is a strong association as well with smoking and with chewing tobacco. But what the connection between chewing tobacco, human papillomavirus, and the vaccine, and the cancers of the mouth and throat are, we don't completely understand that. I do know this much. It's very hard to prevent secondhand smoke exposure, especially if you live here in Nevada, where smoking is epidemic and where smoking in restaurants and the casinos goes on in spite of anti-smoking laws. If you have a smoker at home, sure, that smoker should stop to protect the children in the household. Unfortunately, that tends to not happen a lot of time. And if you're out and about, you're going to be exposed to a certain amount of secondhand tobacco smoke, whether you like it or not, simply because it's there. And the only way to avoid that is to live in a plastic bubble, not so easy to do. Since we can't avoid that, I strongly recommend protecting your children against that which we can protect against, the cancer-causing strains of human papillomavirus. If the association that is there in the throat is between a 1-2 punch combination of tobacco exposure and HPV exposure, if we can't eliminate the tobacco exposure, we can eliminate the HPV exposure, and we can do that with human papillomavirus vaccine. So what are the risks of the vaccine? Because this is floating all over the internet. Realistically, very little. Soreness, local injection site discomfort. If you have a history of anaphylaxis or severe allergy to some of the components of the vaccine or to a previous dose of the vaccine, however, that's extraordinarily rare. And passing out immediately after the vaccine, because when you keep poking teenagers in the arm every couple months, eventually they start passing out on you when you come near them with a needle. Of course, that happens to certain physicians too, and we have videos that serve as evidence of that for you, so if you want to watch me pass out, and that's not from a human papillomavirus vaccine, you can certainly watch that in a different video. How is the vaccine given? It's given in the arm. Who gets it? Anybody, boy or girl, over age 9. And I recommend doing it the sooner the better. So I recommend it starting at age 9 as soon as you're old enough to be vaccinated for it. A lot of people say, well, gee, we want to wait until my child is older. And I say, why wait? Because you want to run the risk that your child might somehow be exposed. Get the vaccine, get protected as soon as you can. I keep hoping that the age for approval will drop and we can give it to younger and younger and younger children so that we can protect them while they're still living at home in the parents' cocoon and not starting to get into trouble at school and have difficulties elsewhere where it's too late to then protect these children. In the last year, I've seen 3 new cases of HPV in my female patients. In all 3 cases, the parents were amenable to the vaccine, but they had wanted to wait until she was a little older. I guess we waited a little too long. We could have prevented that suffering for those children. Again, without a whole lot of risk. In spite of what's floating around on the internet, the reality is not much. So I hope that this has answered some questions about the vaccine and about the disease and about the relationship between HPV and warts, and why we're vaccinating boys as well as girls. This is not a vaccine for cervical cancer. This is a vaccine to prevent human papillomavirus-induced cancers, including the cervix of the uterus of a female, including the penis, including the anus, and including the mouth, throat, head and neck. And that last one's very common. How many doses is it? Well, it depends on which strain of vaccine is being used and who we're giving it to, etc. But the one that we use in my office is 3 doses, given one at time 0, time 2 months, and time 6 months. This is the only vaccine that can be given to both boys and girls. There's another one for girls that's just given twice, one at time 0, one at 6 months, but is not approved for use in boys at this point in time. So I hope this has been enlightening. If you have questions, we'd be happy to see you here in our office to discuss this further. Area code 775-359-7111. This is Dr. Windisch from Sparks Pediatrics. See you next time.